So I'm back with my giant teeth and we're going to talk about how to do that toothbrushing to help you keep your teeth for longer and to keep your whole body healthy and your mental health as well. Okay, so we're going to talk about manual toothbrushes because not everyone has an electric toothbrush, and when people haven't powered their electric toothbrush up, they often resort to a manual toothbrush. So I would say the majority of people have got a manual toothbrush. The smaller the head, the better. All right, so that is an adult size. Okay. And what we're going to do is go to a 45-degree angle onto the gum. All right, I'm trying to do it backwards, so bear with me. So you do your 45-degree angle onto the gum, and then you do little circles round. And that makes sure that those bristles are really getting into this gum margin here and on this side of the tooth. Okay, so really get in there, do those nice circles round. See those bristles really moving, really getting into that gum margin. Okay, that's going to help keep those gums really healthy. It's going to stop the bacteria build-up, it's going to stop the plaque build-up, it's going to get rid of some of that smelly breath that we all get really embarrassed about but we don't like to talk about. Don't forget all the surfaces. You're going to aim to spend 2 minutes when you're brushing your teeth each time, and twice a day. The most important one is last thing at night. I have said it before and I'll say it again, the more that we get that one in last thing at night, the better. It helps clear the food debris, helps reduce the bacterial load, it keeps our teeth stronger because we're using a fluoride toothpaste which protects them overnight when our salivary flow reduces. In the day we have those natural buffers in our saliva to help protect the teeth. We don't have so many of them at night, so we need to make sure that we're getting rid of all of the things that we could end up with decay or gum disease. Both of them are really important, and the more we do, the healthier our mouth is going to be. So don't forget the bottom give them a good scrub on the biting surface. Again, you do 45-degree angle onto the gum and little circles round. Okay, and you can just see how that brush really gets into all the nooks and crannies. The trick being that it's the small head. The smaller the head, the better. On the bottom, you may want to flip that toothbrush up, smaller surface area again, to get right into the back of these bottom teeth. Now this is where a lot of people have a lot of build-up, and you can keep on top of it. It's tricky to get rid of it all, and I would say of the people that I see, 95+% end up needing a clean down there. But the amount that you need to clean off can vary, and the more that you're doing, the less the build-up is going to be. The reason you get that build-up there is there's a salivary gland that exits right behind those teeth, and that saliva is packed full of tons of calcium. So it's a bit like stalagmite or stalactite formation. If you've got that plaque on there, on the teeth, then the calcium in the saliva hardens it, and as soon as it hardens it, more and more builds up on top of it because it's a rough surface. So the more we can get into the back of the teeth really, really well with our toothbrush, the less build up we're going to have. So please, top tip number 1, get in there with your toothbrush as much as you can. Minimum twice a day, 2 minutes each time as a minimum. You could go for longer, I don't mind that. You get brownie points if you go for longer, but really make sure that every single surface of the tooth is clean. All right, take care everyone.